Hi, good morning, Neil. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 7th of November 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Neil Johns.
All right, Neil, could you please confirm your candidate number?
Yes. My candidate number is 420430530.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Describe a situation where you had to think on your feet to solve a complex problem in a previous nursing role.
In my previous role, we experienced a sudden influx of patients due to an emergency situation. To manage the situation effectively, I quickly organized a huddle with the healthcare team, delegated tasks based on each member's strengths, and streamlined communication channels. This allowed us to provide prompt and efficient care to all patients, ensuring that everyone received the attention they needed during a critical time.
How do you prioritize self-care in a demanding and high-stress profession like nursing?
Self-care is integral to maintaining a healthy work-life balance, especially in a demanding field like nursing. I prioritize self-care by establishing a routine that includes regular exercise, mindfulness practices, and adequate sleep. Additionally, I ensure I have a support system in place, whether it's through mentorship, peer relationships, or professional counseling. By taking care of my well-being, I can approach my nursing responsibilities with a clear mind and better serve the needs of my patients.
How do you handle situations where you disagree with a physician's treatment plan?
In such situations, I believe in open communication and collaboration. I would respectfully express my concerns, providing an evidence-based rationale for my perspective. Effective communication is crucial in the healthcare team, and I believe that, through respectful dialogue, we can work together to find the best course of action for the patient.
Describe a time when you had to innovate or think outside the box to solve a problem in patient care.
In a previous role, we faced challenges with patient education due to language barriers. To address this, I collaborated with interpreters to develop multilingual educational materials. This not only improved communication, but also empowered patients to actively participate in their care. It highlighted the importance of adapting and finding creative solutions to meet the diverse needs of our patient population.
If you had the opportunity to change one aspect of the healthcare system, what would it be, and how would you go about it?
If I could change one aspect, it would be to improve nurse-patient ratios. Adequate staffing is essential for delivering quality care and ensuring patient safety. I would advocate for policies that address this issue, working collaboratively with hospital administrators and policymakers to implement changes that positively impact both nurses' workloads and patient outcomes.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Thank you, Mihiraa, for allowing me to examine your burn. I'd like to confirm the presence of swelling and redness around the affected area. Based on my examination, it seems to be a superficial dermal burn, which means it affects the top layer of your skin. How are you feeling right now?
Nurse Johns, it hurts a bit, but I'm okay. I am just worried about what I should do about it.
I understand. Now, I'd also like to know if you've taken any measures to care for it so far. Have you, for instance, cleaned the burn or taken any pain relief?
Yes, I ran cold water over it for a while, and I took some over-the-counter pain relievers.
Good, that's a good start. I appreciate your sharing that with me, Mihiraa. It's evident that you've taken some proactive steps in managing the discomfort. Now, let's discuss the possible treatment for your burn. Since it's a superficial dermal burn, it is generally mild and requires some basic care. We usually recommend basic first aid, like cooling the burn and keeping it clean. It's advisable to leave the skin intact. This helps in promoting the natural healing process. Additionally, you may consider using a non-stick dressing over the burn to protect it. This can help prevent any friction or irritation. If you're experiencing pain, you can continue with the over-the-counter pain relievers you've been taking, and you may also use a burn cream to soothe the area. Do you have any questions or concerns about the treatment options?
No, that sounds all right. How long will it take to heal?
I understand that experiencing a superficial dermal burn can be distressing, but it's essential to know that these burns are generally mild and can be effectively managed with basic first aid. The initial step in treating such burns involves prompt and gentle cooling of the affected area with cool running water for about 10 to 20 minutes. This helps alleviate pain and minimize tissue damage. Following this, protective measures for a superficial dermal burn involve keeping the area clean and covered with non-stick bandages to prevent further injury. Topical treatments, such as over-the-counter burn creams with aloe vera, reduce inflammation and promote healing. Also, hydration and a balanced diet support overall skin health. Following these measures consistently, along with patience, ensures a successful and relatively quick recovery.
All right, I got it.
Mihiraa, it's crucial for you to understand that superficial dermal burns typically do not lead to complications. The healing process is often swift, and you can expect improvement within 14 days. Moreover, the risk of scarring is minimal, assuring you that the impact on your skin's appearance will likely be negligible. It's important to be patient with yourself during this healing journey. Mihiraa, do you have any other concerns about taking care of the burn at home?
I think I understand. But, is there anything specific I should watch out for?
Great questions. To ensure a smooth healing process, it's advisable to take some additional precautions. Firstly, try to minimize sun exposure to the affected area, as sunlight can aggravate the healing skin. Elevating hand periodically can help reduce swelling and promote better circulation. It's crucial to keep a close eye on the healing progress and be vigilant for any signs of infection, such as increased redness, swelling, or the presence of pus. If you notice any concerning changes, don't hesitate to seek medical attention promptly.
Nurse, do I need to see the doctor?
Mihiraa, it's crucial to be aware of when to reach out to your GP during the healing process. If you notice no improvement in the burn after 1 week, or if you have any concerns about the healing progress, it's essential to schedule an appointment. Also, if the pain persists or worsens, that's another indicator to seek medical advice. Do you have any specific concerns or questions about these instructions?
No, I think I got it. Thank you for explaining everything, Nurse Johns.
You're welcome, Mihiraa. If you ever have additional concerns or notice any changes, don't hesitate to reach out. Take care, and I hope you feel better soon.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.